So, good evening. This is the fifth session of Delaware Mini Medical School, and as usual, we are going to advance through the first few slides with our socials and about the program goals, Delaware Youth Mini Medical, Youth Medical Academy, housekeeping tips. Just to say once again, you have to stay through the end of the official presentation. Once Q&A starts, that's when you can leave if you want to, but that's when the good stuff usually happens. We only use the Q&A feature, not the chat feature. Raising hands won't do any good because we don't see that. And at this time, I'm going to kick it on over to Christy Handley with the Sussex County Health Coalition to introduce this evening's speaker.
Thanks, Tim. So tonight's speaker, we have Rebecca Robinson from Bay Health, working in radiology. She's a radiologic technologist at Bay Health. She has her bachelor's degree in health science, 14 years of healthcare industry experience with expertise in the radiology field. She's a seasoned radiologic technologist with Bay Health, like I said, super user of the EMR systems, and I'm sure she's going to explain what that means. Expert in utilization of GE, Fuji, Siemens, Philips, and OEC X-ray equipment. She's a clinical instructor and a new hire preceptor. In her personal time, she enjoys running, going to the beach, and spending time with friends and family, and is a devoted mother of 2 daughters. Rebecca, thanks for joining us. We're going to turn it over to you.
Thank you so much. I'm going to go ahead. Can I share my screen now?
You can.
All right.
You've got it.
It is not letting me do. There it is. Okay. So, like Christy said, my name is Becky Robinson. I work for Bay Health as one of the X-ray technologists. Just a little bit about myself. Let me move this. I went to high school. I went to a vocational high school. I graduated in 2000. When I graduated, I did not know what I wanted to do. I kind of bounced back and forth. I finished the vocational high school with a CNA. I studied nursing. I knew I wanted to be in the healthcare field. I just didn't know what I wanted to do. It wasn't until probably I was about 25 when somebody mentioned to me about X-ray. So I decided, yeah, that sounds great. I went back to school and I graduated from Del Tech in 2010 with an associate's degree in radiology. It took me almost 12 years later to decide that I wanted to continue my education, and I actually graduated this year with my bachelor's degree in health sciences. At the hospital, I have a lot of responsibilities. The EMR is our electronic medical record. I am the super user. I am able to show all the new technologists and with all the upgrades of our health systems. I train all the new X-ray technologists that we hire on all of our equipment and our protocols. And I'm also the clinic instructor. So the students that attend Del Tech and for the radiology program travel to each one of our hospitals throughout the state, and they all need an instructor at the hospital. And for Bay Health at Sussex County, I am that instructor. So I teach all the Del Tech students that come through. For me, I think this is one of the most exciting fields to learn in, and that's why I'm here today. I just want to kind of give you a little glimpse of the world of radiology. But what is diagnostic imaging? The medical term for it refers to the techniques and processes used to create images of the human body for clinical purposes or medical science. We help in diagnosing diseases, guiding treatments, and monitoring different medical conditions. But what does this really mean to us? Basically, it means that we can see inside the human body. We use different imaging techniques to help physicians diagnose different illnesses. We always hear about patients being diagnosed with different things like cancer, fractures, COVID, but how do physicians actually get these diagnoses? Well, sometimes they need the help from us. There are different modalities or different areas of diagnostic imaging. There is X-ray, CAT scan, MRI, ultrasound, nuke med. There's a broad spectrum of different types of imaging. I personally only do X-ray, and I'm going to explain what that is, but I want to touch base on a little bit of the other areas that you could also train into. So going from X-ray, you can go into these other different areas of imaging. So X-rays. X-rays are forms of electromagnetic radiation. They travel at high energy that passes through the body, creating images on special detectors. So basically, it creates us to be able to see inside the body. They allow doctors to diagnose broken bones, infections, and other internal conditions, hopefully without surgery. This is a typical X-ray room here. And if we look here, all the X-ray rooms are lined with lead. X-rays can't travel through lead. Once they hit a lead wall, they kind of dissipate. So this area right here is called a control room, and we stand back here to take the X-ray so that we don't get exposed to any of the radiation. When we take an X-ray, this is the tube here, the X-ray tube. They come out of here, and there's a special detector in this table here, and it uses a Wi-Fi signal to send an image. It's a digital image right to our computer system, so we can see our picture immediately to know if we need to take any additional images. So again, this is just a typical X-ray room. Kind of every hospital has one. We X-ray every single type of patient in the hospital. We do outpatients, which are regular patients that come in from a doctor's office. Inpatients are patients that stay into the hospital. We X-ray emergency room patients, and we can X-ray any age patient, from babies to adults. These are kind of some of examples of common X-rays that we can do. So X-rays show basically bones and air. We can't see vessels or organs in the human body unless it's highlighted with different contrast. So this is a right hand. You can see the bones in it. This is a skull. This is an entire lower leg from your hip joint all the way down to your ankle joint. And this is a cervical spine. This is your neck here. So this image here is an image of an abdomen. You can see this darkness right here is air. This person's intestines is filled with air. The only way that we can see these intestines is because it has air in it. If it didn't, it would look like this over here. This image over here, the patient has had contrast placed into their intestines. Typically they drink it, and the contrast then turns white with our X-rays, and we're able to identify where the organs actually are. Another fun aspect of X-ray is that we get to be a part of so many different things throughout the hospitals. And one of those is the operating room. This is called a C-arm. This is an X-ray machine that we take into the operating room to help surgeons perform surgeries on different fractures. We can help remove kidney stones. We help work on spines, joint replacements, and even some cardiovascular procedures. This here, it's called a C-arm because of the shape of it right here. This is a C here. And then we stand back here and we control the X-ray from back behind this side here. Another area that we can go to is we can take some X-rays portably, meaning that we can take this type of particular machine here and actually take it to a patient's room. And why would we take something portably versus bringing somebody to the room? There's a couple different reasons. If patients are too sick to come to us, we can go to them. We can't always bring our X-ray machine to them, but we try if we can. If the patient is on any type of isolation precaution, meaning they have some sort of disease that is contagious, the patient has to stay in the room, we can go to them as long as we wear the proper coverings to protect ourselves. We also go portably. We take an X-ray machine to trauma situations in the emergency room. We are part of the trauma team. So when a patient comes into the emergency room for things like car accidents and things like that, we respond immediately and we're able to help out and take immediate X-rays right there in the emergency room. Some of the other modalities that is part of diagnostic imaging, one of them is CAT scan. CAT scan is a computed tomography scan. It also uses radiation. It takes images a little bit differently, though. It takes things as in a cross-sectional, kind of like a loaf of bread, so that you can see down through the body, not just a flat image. CAT scan can show a lot more than what X-ray can. CAT scan can see bones, organs, tissues, vessels. It's a more detailed view of the human body. Again, it's an area that you can train into once you become X-ray certified. This is what an CT machine looks like. It looks like a big circle, and the patient actually goes in and out of it to get these different slices of images. So comparing images, this is kind of what an X-ray would look like. And then this is what the CAT scan looks like. So it's a very detailed image. It's almost like we're looking down the body to get different slices and see vessels and bones and things like that. MRI stands for magnetic resonance imaging. MRI doesn't use radiation at all. It's a giant magnet. So it looks just like a CAT scan. It's got the big circle. The patient will go in and out of it, but it uses a magnet. The magnet responds to the body and produces images that way. It's typically used to look at non-bony parts, but it does see bone as well. This is an example of what an MRI would look like. You can see the bone, you can see the spine right here, but they're typically looking for structures in between the spine. They're looking at organs or muscles, things like that. Ultrasound is another modality that you could be interested in. It doesn't use radiation either. Ultrasound uses high frequency sound waves to create real-time pictures and videos. Ultrasound lets the providers actually see details of soft tissues and vessels inside the body. They use these probes, and the sound waves creates like almost videos you can actually see. But one of the biggest things that everybody loves with ultrasound is seeing a baby. So you can see this baby is inside the womb. You can see the head and the body, the spine is here, and the feet are coming up this way. Nuclear medicine also uses a form of radiation. They are called radio tracers. It works a little bit opposite of X-ray. X-ray, we're taking radiation and shooting it through the patient and then creating pictures. Nuclear medicine, actually, they take their radio tracers and inject them or have the patient swallow or inhale the radiation into the body. Nuke med shows how the organs or tissues are working to make sure that they're properly functioning correctly. So when they inject these radio tracers into the body, it creates these hot spots in the human body. So when there is a hot spot, these different colored areas, each different colored area means something different. Then the radiologist can order an X-ray or a different study to look at that particular area. It could just mean that something's not functioning right, or they have arthritis. And that's where the other modalities would come in to help diagnose what those hot spots are. So we've talked about the different types of imaging, but what can we actually see? This is the fun part for me. I like looking at the different X-ray images and help diagnosing different things. So it would be typically a normal chest X-ray. This is the outline of the heart. This is the clavicles or your collarbones. This black is air. So remember I said that air shows up on X-ray. So these are your lungs. So again, this would be a normal chest X-ray. This is actually an X-ray of a patient that has COVID-19. You can tell, you can see a difference. These lungs are very cloudy. It makes it very difficult for the patient to breathe. If I go back to this one, you can see that it doesn't look as cloudy. There's markings, which are normal. And then we go to here, and it looks like there's clouds inside of this X-ray. COVID-19 took a big toll on the healthcare industry. And as part of the X-ray team, we were constantly in it. Every single patient that came into the emergency room got a chest X-ray, not only once, but multiple times. So we were constantly exposed to COVID. We did wear the proper PPE so that we were protecting ourselves, but we had a big part in helping diagnose COVID for a lot of patients. This is another chest X-ray, and the biggest thing here to look at is this big round circle right here. A lot of patients will come into the and get a normal chest X-ray. They may be having chest pain or shortness of breath. They come in and get a chest X-ray, and we find something like this. This is actually lung cancer, and we are usually the first ones to find it. They will then typically go to CAT scan, where they may have a biopsy done. A little piece of the mass will be pulled out of the lung and tested to see what it actually is. So yeah, so this is a very large mass inside the patient's lungs. Cancer can look like a couple different things, and we find it, unfortunately, frequently. This is a lesion inside of a patient's knee. This is the same lesion, and that is bone cancer. These are all examples of bone cancer. These dark spots in this patient's skull, these deformities in the fingers, these are all things that we help diagnose. We help the radiologists diagnose where the cancer may have spread to. Sometimes we cause our own illnesses. For example, this is a patient's lung that is very cloudy and very unhealthy, and it's due to patients vaping. A lot of young people don't realize the damage that they're causing to their lungs. This is all scarring and cloudiness that is going to make it difficult for the patient to breathe, or they could eventually not be able to breathe on their own. One of my favorite parts of the job is seeing the before and the after. This is an initial injury. The patient has come into the ER and they have broken their ankle in multiple different places. So this is what it looks like before. Then the patient gets to go to the operating room where we get to go in and participate with our C-arm. And with our C-arm, we help the orthopedic surgeons put these screws and these plates in the bone so that the patient's able to walk again. So that is one of my favorite parts, just the before and the after. I'm sure that we are all guilty of doing something like this in the car, but this is actually one of the most unsafest ways to position ourselves in a vehicle. If this car were to be in an accident, this patient is going to be severely injured or worse. The next image is what could happen to you. You can actually see that the legs, both legs are broken. This left leg here, this is a left femur. It's completely broke in half. This is the right leg, which is supposed to be up here into this space here. And that's all from putting their feet on the dashboard. So seeing inside can mean so many things to diagnostic imaging. And we have one goal, and that's to treat and diagnose patients. It's why I do it. I enjoy it. Again, thank you guys for your time.
Great. Thank you so much, Rebecca. We greatly appreciate that presentation.
Thank you.
All righty. Christine, do you handle the Q&A?
I can if you'd like me to.
Sure.
So we'll start off with, are there different types of x-rays for different parts of the body?
It's not necessarily different types. We use a different amount of radiation for different parts of the body. Obviously, bigger parts are going to need more radiation. We may even have to use different machines, but it's the same type of x-ray.
Okay. If you do too many x-rays, does your body get harmed in any way?
X-ray has changed so much throughout the year or throughout the years that the dose that we receive is so minimal. I remember going through X-ray school and learning that you get more radiation going in an airplane ride than you do from a chest X-ray. So one chest X-ray is not going to hurt you whatsoever. They have improved the amount of radiation, I guess lessened the amount of radiation that anybody receives with x-rays. Even since I graduated 14 years ago, they use the least amount as possible to get the best image that we can.
Great. Would there be a specific time where a person would need to fast when taking an x-ray of the abdomen?
So Yes, actually. So fasting would come when we do procedures where patients have to drink barium. So when a patient has to have an upper GI or an esophagram, and that's where they drink contrast, we need that stomach to be completely empty because we fill it with contrast. Excuse me, but that is the only time that anybody would have to fast for just a standard X-ray.
And that barium allows them to see more within that X-ray that you take of them, correct? More of the
Yeah.
organs, those kinds of things.
Yep, that is a picture. Here. So this highlighted white area is barium. That is what the patient has drank to highlight the intestines and the stomach area.
Thank you. I think this is kind of the same. How dangerous is the radiation to the patient being examined? But you've already answered that one for us.
Yep, no danger.
Do you have to be graduated with radiology degree to handle ultrasounds, or is that a separate degree?
So ultrasound is recently become a second degree. You used to be able to cross-train into ultrasound, but as of a few years ago, they made it its own program. So Deltech has their own ultrasound program now.
There's two questions here. For x-rays in the OR, how do you protect the doctors, nurses, and patients from radiation?
So as far as the doctors and the other staff in the room, we all wear lead aprons. So lead cannot go, x-rays cannot pass through lead. So we all wear lead aprons to protect ourselves. As far as the patient goes, it depends on what we are working on in the OR, if we can actually cover them with lead or not. Children and women of childbearing ages, we try to protect them at all cost, if we can. But in OR and emergent situations, the benefits are going to outweigh the risk of a little bit of radiation from the C-arm.
Okay, and so during the surgeries, it says, do x-rays during surgery increase risks of complications from the radiation?
No. X-rays, radiation does not make any risk whatsoever. In fact, it's opposite. We help. If they didn't have us, things could be much more difficult for the surgeon.
All right. Are radiology techs trained to diagnose images?
No, we do not. We do not diagnose whatsoever. Our job is to obtain optimal images so that the radiologist can diagnose. We take pictures and then we send them to the radiologist. Now, obviously, we see so many x-rays that we can tell a lot of the times if something's going on, and if we see something of importance, we may end up calling the radiologist and saying, hey, can you take a look at this one for me? I see something funny on it, but we cannot diagnose.
So when you're looking at an x-ray, can you tell the difference between somebody who's been vaping and maybe it's something else?
A lot of the times we can't tell if the patient is vaping until we get a patient history. We can see something in the lung field that may not look appropriate, or something that may look abnormal. But a lot of times the diagnosis, this is going to come with the patient history too. So if we see something that's abnormal in the lung field, if we ask the patient, do you have a history of smoking or vaping? That pretty much gives us a good idea of what's going on.
Are mammograms a type of radiology?
Mammo is, and that is one that I didn't touch on. Mammo focuses on its mammography, and it focuses on breast imaging only. It does use radiation, and it is something that you can cross-train into once you are finished with your X-ray school.
So it's a specialty.
It is a specialty modality. It is.
Right. How does the x-ray contrast affect a body? And does the digestive system absorb it?
So we Barium does not get absorbed. Barium will actually, if it is not flushed out, it can harden and almost constipate a patient. So we encourage a lot of water after we do a study for barium. We do have water soluble contrast that we use for patients and in different cases where they may suspect the patient may be going to surgery. We'll use a different type of contrast that will dissolve in the body.
Okay. So the contrast that's given during a CAT scan, when they put an IV in and they push it through.
Yep.
How is that absorbed? How does that move through the system?
Yeah, so when you get contrast in an IV, that is going into your vessels, and that is water soluble, and that is the contrast that will dissipate throughout the body. A lot of times you'll urinate them out. They'll go through your kidneys and then you'll urinate it out.
And the other thing, if I can just interject, that
Yeah.
some people don't know is that that kind of contrast administered through IV often, but not always, I believe, can cause a warm feeling.
Mm-hmm.
Sort of starts and creeps through your whole body. It's like drinking hot coffee.
It does. It almost makes
Mhm.
you feel like you have peed yourself.
It does.
It's very warm.
Yeah, it's an odd
Yep.
thing.
Yeah, it is. Mm-hmm.
Do you have to know exactly what you want to go into when you go into college? So do you have to know which specialties, those kinds of things?
No, and that's the good part about X-ray. So I currently have a group of students, they're X-ray students, and they are actually rotating now through all the different modalities to learn about them as well. So they get a couple days a semester to see if it's something else that they might be interested in.
Okay. How many different kinds of contrast are there?
Um, there's probably two different kinds. There's the water soluble and non-water soluble. Um, and but there's so many different consistencies, I guess, different thicknesses or of the different contrast, and they're all used for something different.
This is a good question. How can you decide when a patient enters the hospital, which type of imaging are you going to use? So are you going to use an MRI, CAT scan, X-ray?
So that decision is actually left up to the ordering physician. I don't get to make that decision. They come to us with a doctor's order that tells us what that physician wants. Sometimes the physician isn't even sure which one will be best for what they're looking for. So they'll call and talk to the radiologist and figure out which would be the best modality for that, what their diagnosis they're looking for.
In undergrad, what did you major in? Did it have to be related to your current job?
Um, I did. My bachelor's degree is in health sciences. So I am able to, with my health sciences degree, I can go in a couple different directions with it. I can go into teaching, I can go into management. It just all depends on what I want to use it for. But I made sure that it was related to healthcare.
All right. Does the patient feel anything in an MRI due to the magnetic?
No, but it's very loud. It is very, very loud. Patients actually wear earplugs, and then the technologists actually give them headphones so that they can hear music. So you don't feel anything. It's just very loud.
And I've got a question for you,
Sure.
Rebecca.
Yeah.
Um, maybe this isn't used much anymore, but what about fluoroscopic uh, contrast agents and that whole type of imaging?
Yep. And that is what we use the barium for. Fluoroscopy is live X-ray. Live X-ray is what we use our barium in. So when a patient is drinking their contrast, we are using live X-ray or fluoroscopy to record it. We're recording as that barium is enters into the esophagus and into the stomach.
Yay.
Mm-hmm. Yeah, it tastes great.
Not so much. Is the radiation the dye you ingest, or is it the radiation coming out of the machine itself? In other words, where's the radiation coming from?
So with X-ray, the radiation is actually coming out of the actual X-ray camera. The radiation is coming out of here and going down through the patient and being absorbed into a detector. But when you're in nuclear medicine, it's opposite. That patient is actually going to become radioactive, where they actually swallow the radiation. They mix radiation tracers, radio tracers into food, and patients actually swallow it.
Interesting.
It's very opposite of what I do. Yep.
Are there any conditions that you can't X-ray?
Um, any conditions we can't X-ray? Um, I don't think there isn't really anything that we can't X-ray. We may not be able to diagnose it without the help of a different modality or a different, maybe a blood test or something, but we can X-ray anything.
With maybe one exception, which would be if somebody presents with a behavioral health condition, it might take a lot more than doing an MRI to figure out what the basis for that is. Maybe.
Correct. Yeah. So I'm not sure as far as mental illnesses, what they could see on an MRI. But as far as X-ray goes, we can't see anything. We see structures.
Right.
Mm-hmm.
Are there new technologies taking over the function of an X-ray? Do you think that the X-ray will ever become outdated?
So I hope not. But just in my experience, things have changed so much since I've graduated. X-rays went from using actual film to a CR plate to now everything being digital. So everything is so much faster. I don't see X-ray ever going away. I just see the technology improving. And I don't know what that would mean for us as technologists in the future.
All right. Got another question. So from what I've heard, you've been talking about all these different techniques for doing the diagnostic side of things, but what about the use of radiation as a curative tool like proton therapy or things like that? Do you get involved in that in your work as well, or is that a different branch of medicine?
So it is a part of diagnostic imaging, and it is actually called radiation therapy. They use a lot of radiation for cancer patients. And that is even more schooling. So once you finish X-ray school, it's an additional school after that.
Right. And then can you tell us more about what interventional radiology really means? Like maybe give us an example.
Yeah, so interventional radiography uses fluoroscopy or live X-ray to look at different vessels and place different lines inside of a patient. So one of the first things I think of is it's called an IVC filter, and it's a filter placed into part of the aorta if patients have blood clots, and you don't want those blood clots going to the heart. So they put this filter inside of the vessels to prevent these clots from going into the heart, and they use live X-ray to place that inside of the body.
Oh, I'm going to give a stab at answering a question here, and you correct
Sure.
me if I'm wrong. I'm going
Okay.
on the limb here. There's a
Okay.
question, are cancer rates in general higher than usual for radiologists? And I'm going to break it down this way. I think before probably 1940, the answer may have been yes. But now with the awareness, the protective gear and whatnot, I believe that the cancer rates are actually lower if you look at the entire medical cohort juxtaposed against just radiologists. Radiologists don't have a higher incidence of cancers that would have been caused by the very diagnostic techniques and curative techniques that they're employing.
I would have to agree with you. I am not familiar on the actual rates of it, but I know that we protect ourselves so much while we're in the room. We wear lead aprons. The radiologists sometimes will wear lead glasses so they protect their eyes. Some of them are now even wearing lead like caps on their head to protect their brain and things like that. So there's lead in the rooms. We do a very good job at protecting ourselves against it.
The proverbial tinfoil hat.
Yes, well, they don't quite look like that. They are actually almost fashionable.
Oh, God forbid.
Yeah.
Hey,
Mhm.
do X-rays travel in a straight line or do they bounce around?
They only can travel in a straight line and they only go 6 feet and then they dissipate.
Sweet.
Yep.
Um, oh yeah, that's right. Is the really thick chalky contrast still used or is it more of the watery type now?
Nope, it's thick and chalky. It is the
Uh,
barium and it's supposed to be strawberry flavored, but I don't buy it.
yeah, no, I've been told that lie. You're right.
Yeah. I've had it myself. It is definitely not strawberry flavored.
Um, so interesting question. If referring back to that slide where you mentioned that that was somebody who had been vaping, if
Yeah.
you had let's say a 14-year-old
hmm
come in and showed evidence of vaping, do you have a duty to report, or does the physician have a duty to report, since that technically would be an illegal activity for somebody of that age?
No, unfortunately, we cannot. If they, especially as technologist, I cannot. Um, if the radiologist puts something into their notes about probable cause could be from this or this, then they can put that in their report, but that's not up to me to decide.
Right. Thank you. Can you go straight into the ultrasound program, educational program, or do you have to complete the radiology program first?
Nope, this is a whole new program. You can go straight to ultrasound and you don't have to be certified in radiology at all, just the ultrasound part.
So Sarah Hayes asks, I've heard that mammograms are painful. Why so? And have there been any improvements on how to collect an image? There's a whole history there, but I'm not going to tell it. Go for it, Rebecca.
So mammograms, from personal experience, are not fun whatsoever. And it's squeezing anatomy. So no, they are not comfortable whatsoever. I think the technology is constantly improving, but personally, no, they are not comfortable whatsoever.
Now, there have been some advances, though, and I don't know what the exact technique is, but with the hanging breast mammogram,
hmm
correct? So I guess that actually puts a different kind of stress on the body, but it is certainly something that we talk about a lot. But the bottom line is that you do have to compress the breast in order to get good imaging.
No matter what position your body is, there is still compressing happening, yes.
Well, When studying radiology, does the student have to experience the machines themselves as a part of the training?
Absolutely. So when the student is in the X-ray program at Del Tech, they do classwork, but they do they do a lot of clinical time. In the summer, they are at the hospital 40 hours a week. It is a demanding program, but I think it's necessary. When the students are out of the hospital, they're getting their hands-on experience, not only with the equipment, but with patient care. Real life experience is the best experience. So yes, they are hands-on every day. Even at the school, they have x-ray machines at the school, and they have dummies that they can practice taking x-rays on right at the school too.
Cool. You mentioned that contrast can be inhaled. How is that done and under what circumstances?
So contrast can be inhaled. They do that during nuclear medicine, and I'm not sure the exact process. I know that they breathe it in somehow. They have some sort of mechanism that they breathe it in, and they do that to test the lung function. So for some reason, the patient may be having difficulty breathing, and they need to actually see how the lungs are functioning. So they inhale this radiation and then take pictures of the lungs with the radiation in it.
Right, and then Amy Pollock asks, how does IV contrast affect the kidneys? And I'm going to add on to that. And what kinds, if any, adverse events can occur from IV contrast?
So IV contrast, we always have to be careful of. IV contrast has a higher chance of somebody being allergic to it. It goes through directly, into the vessel, so it's going to go through the heart and the kidneys. So there's no real anytime they give contrast, they're always checking the kidneys levels. They want to make sure that your kidney levels are properly functioning so that your body can expel the contrast appropriately. If your kidneys aren't working appropriately, they're not going to give you the contrast.
So if you have chronic kidney disease, end
No,
stage renal failure,
you will not be
contrast,
getting IV contrast.
right? And then
Mhm.
some of the other adverse effects, nobody asked it, because they've been very focused on how we eliminate it, but
Mhm.
there could be allergic reactions.
Mhm.
You can have cardiovascular implications,
Yes.
certainly nausea and headache. Oh yeah.
Yep. Yep.
Is it
Absolutely.
is it the end of days? No, but but yeah, it could definitely happen. Let's see.
There is, if patients are, we have some patients that are allergic to contrast, but sometimes it may be necessary to give it to them. So a lot of times they'll prep them beforehand. They'll give them like a Benadryl treatment beforehand to try to prevent any adverse reactions.
Right. Um, what about patients who are claustrophobic? Some of those machines are pretty tight.
They are very tight. Um, if it's severe enough, some patients are medicated to actually go in, given some type of anxiety or some type of medication to relax them to actually get the study done. There is, for MRI, I know there is a wider version, but it doesn't feel as enclosed, but you're still enclosed. So a lot of times it's just a little bit of anxiety medicine to kind of relax you down.
Or a lot. Yeah, a question here from Elizabeth Pont about 3D mammography. And
Mhm.
she hears that that's becoming the new standard. How is that done?
It's a different machine. Again, I'm not 100% sure, but I know it's a different machine and they're able to take um different types of imaging. It gives the radiologist a better view of the entire breast.
Right. Tomosynthesis, I believe. Um,
Synesis.
yeah, tomosynthesis,
There's
DBT,
sense.
digital breast tomosynthesis. Yeah, 3D breast.
Yeah.
How many years is it to become a radiologist? And well, now for the person asking, do you mean a radiologist, a physician radiologist, or do you mean
The
the kind of work that
technologist.
Rebecca's doing? Two very different questions. So whoever asked that, if you're still here, ask that again and tell us exactly what you're asking about. What are some cases where you need to use contrast? What are the typical cases where contrast needs to be added to show things up?
So every day, basically every day, we have outpatient studies scheduled where we do patients for an esophagram or an upper GI where we're actually looking for reflux from the stomach back up. We put contrast, have them drink it to see if it comes back up. We do studies where we inject contrast into different joints. And then once we inject contrast into a joint, sometimes they're sent to a different modality, and then they have those imaging studies done with contrast in them.
All righty. Oh, Bill and Gandhi. Oh, you asked a doozy of a question.
Uh-oh.
Might not be the right person or the right time to ask, but generally
That's okay.
speaking, what is cancer?
Oh, goodness. So cancer, I know, is an abnormal cell. It's a abnormal, how can I describe it? It's abnormal cells that destroy the good cells around it. So, and sometimes those cells, it's called, they metastasize, they move to different areas. And then that's why it's so dangerous, because they're abnormal and they are destroying your body. It's the best way I can describe it without being a doctor.
Yeah. Oh, here's another doozy of a question. Are
Okay.
X-rays unique according to race or gender, or do you make adjustments based on race or gender?
No, the only time that we ever make adjustments is age, or body habitus, depending on how large or how small a patient is. Um, when the larger the patient, the more amount of radiation that we need to penetrate through the body. The younger the patient, the least amount of radiation we want to use is best. So it's based on body size and age.
All righty. Um, Person says, after being a longtime smoker and not having any lung damage, how long does it take for the lungs to recover and for a person to be totally healthy again?
I person I can't speak medical diagnosing wise, but I'm once you are a smoker for a long period of time, the damage is done. I don't think it gets better, but I don't think it'll get worse if they stop smoking. Smoking and vaping causes scarring in the lung tissue, and that scarring just never goes away.
Yeah, I agree with that.
Yeah.
Um, Amy Pollock asks another question, but I'm not quite sure whether there might be a spelling error here, but I'll ask it as she typed it. How do you
Okay.
tell the difference between a voodoo X-ray of heart failure, pneumonia, or COVID-19?
Of voodoo?
Uh,
Um,
VUDU. So Amy, if you want to retype that question, if you're still here, we'll give it a shot. How difficult is it to get into a radiology tech program? What subjects are needed? And I think that what Naomi's ultimately saying is, uh, in terms of the competitive nature, what kind of a
yeah.
GPA do you need? All that stuff.
Yeah, so for sure. So the radiology program is an associate's degree. So typically you have prereqs that you have to take before you can even get into the program. So the prereqs typically are, your anatomies, your physiologies, your sciences, your maths. And then once you're into the program, it's It changes quite a bit. Sometimes I think now it's done on an interview process. I think you interview for it. You apply to be into the program, and then you actually interview with the teachers at the college, and then they take, I think it's 22 each year, and it's a 2-year program. Once you get in, radiology itself is 2 years, so you have 2 years of clinicals that you have to do. So it ends up probably, just depending on how long it takes you to do the prereqs, 3 to 4 years to actually get to the actual program done.
Okay. And I'm curious, with the slide that you have up right now,
Yeah.
back in the day, which for me doesn't feel like it was that long ago, when it would actually have been developed on film and they would have put it on a viewer.
Yeah.
It always amazed me how quickly a physician could look at that and make sense
Mhm.
of varying shades of gray.
Yes.
Even though you don't do diagnosis,
Mhm.
do you see everything at this point similarly? And can you point things out to residents and say, oh, if you didn't see this, take a look there, tell me what that is?
So, yeah, I have been doing this for a long time. So, 14 years I've been doing this. I can look at a lot of images and determine myself um, if there's something abnormal. Sometimes if I'm working in the emergency room and I take a portable x-ray and I see something that does not look right, I may go immediately to the physician that's working and say, hey, can you take a look at this? And they'll agree and say, yep, I got it. So yes, I can now determine a lot of different pathologies in x-rays, yes.
All righty. Um, oh, what does a typical day in your specialty look like?
So for me, because I'm the clinic instructor, it's a little bit different. I have students every day with me, so I'm constantly teaching them the equipment and how to actually take the x-rays. But for me, we rotate through different areas of x-ray. I can be doing fluoro, which is the live x-ray with the contrast. The next day, I could be working in the operating room. The day after that, I could be working in the emergency room. So my schedule changes every single day when I'm there. And it's actually one of my favorite things. I'm not complacent in what I do. I see something different every single day that I'm there.
I just answered a question myself. Okay, thank you, Amy. How do you tell the difference between X-rays of the heart of heart failure,
Okay.
sarcoidosis, vaping, pneumonia?
So those all look so similar. Um, in chest x-rays, they all look very similar because I don't diagnose. A lot of times I'll have to get the radiologist to help me out. So even when I chose these images, I spoke to one of my radiologists that I work with who confirmed that that's what they diagnose it with as well. So I
Right.
can't, a lot of times can't tell the difference between um pneumonia and um a vaping injury. I would have to actually have the radiologist look at it for me.
Well, and the high likelihood is that if a patient comes in presenting with something that would have
Symptom.
caused you to
Mhm.
X-ray the lungs, there'd be a pulmonologist involved. I mean,
Oh,
no discipline works entirely in a silo, and that's where the combined wisdom of a whole healthcare team coming together for one patient comes into play.
correct. Yeah, we take the image, the radiologist is able to diagnose, and then the pulmonologist can help treat. So it's all one big circle. We all work together as a team to help treat all the patients that come through.
Right, right. And then just want to confirm, there was a question about milligrams for spinal imaging needs, and it's my understanding and opinion that MRIs are the standard now. That there are very rare instances where you'd be injecting a dye into the spine that you then need to pull back out?
It's actually not as rare as you think. We probably do a couple a month in our facility.
What what kind of circumstances lead you to do that over an MRI?
Well, what happens is that we inject the contrast into the spinal canal and then they go to MRI. So what we inject, or a lot of times they go to CAT scan afterwards. It highlights the spinal canal once we put the contrast directly into it, and then they can go to another modality to get those special images done.
Interesting. All righty.
Mhm.
Well, I stand partly corrected, and thank you. But then you say a couple of months, but relative
Mhm.
to overall volume, I mean, how many diagnostic imagings are you doing per month? Is that 2 out of 100 or 2 out of 500 or 1,000?
Um, we do so many. If you compare it to like an injection, like if we get patients that come in that need hip injections, we probably do one or two of those a day, whereas the myelograms maybe one or two a month.
Right. Right. Okay. So it's a relative. I
It's
feel good
still
about what I said. It's a relatively small.
it's
Um,
small. It is for sure.
right. So here's another one of these real basic doozy questions.
Okay.
What really is radiation?
So radiation is it's high energy. It's electromagnetic energy. So there's a whole spectrum of different energies, and they go from magnetic energies to radiation. It's just a really high powered energy that we use to pass through the body.
Okie dokie. Um, if an abnormality is seen using whatever modality you're using,
Mhm. Yeah.
how often is, and in this case, they're saying X-ray. If you do an X-ray and you see something, how often is that X-ray repeated for confirmation?
I don't I don't think we would repeat for confirmation. I think if there was a question, so I'm thinking for an example, if we take an x-ray of something and the radiologist isn't sure if it's a fracture or a mass or whatever it may be, they may send it to another modality like CAT scan or MRI to get a better, deeper view of it. They probably won't repeat the x-ray because we're going to do the exact same image that we did before. So they'll send it to a different modality to get that confirmation.
All righty. How does one image and diagnose a spinal infection?
That is when we do what's called a lumbar puncture.
Ugh.
So, yeah, so similar to a myelogram, instead of injecting contrast into a spinal canal, we're actually pulling spinal fluid out of the spinal canal and then sending that fluid to a lab. So we use our x-ray camera, our live fluoroscopy camera, to help guide the radiologist directly into the spinal canal so that they can pull that fluid out.
I accidentally closed somebody's question and I'll have to go back and go back and find it. Oh no. Christy, can you ask the next question, please?
Sure. What happens if you work in the field and you're pregnant and get exposed while doing an X-ray?
Well, I have had two children of my own in my 14 years of this, and my children are just fine. We wear these lead aprons to protect ourselves. Now, when we are pregnant, we try to avoid from being in the direct path of it. And coworkers are usually very conscious of it, that if we're pregnant, they don't let us do anything near the radiation. We do wear what's called dosimeter badges, and those badges measure the amount of radiation that we get. So when you're pregnant, you actually wear two. You wear one for yourself and one for the baby. And that badge is measured every month to make sure that you are not exceeding the amount that you are allowed to have. So I was pregnant twice, and I never got anywhere near the amount of radiation that I was harmful to me or to my children.
That's a good thing.
Yeah.
Well, I think I vaguely remember what the question was. I don't know what I did with it. You haven't talked, I don't think, about PET scans. Can you quickly walk us through what that is and when it's used?
Yeah, so PET scans is again something that I don't do, but I do know it's very similar to Nuke Med, where they're using it as like almost like a cancer tracer. They give the patient radiation, and it's going to highlight through the body. And if it highlights anywhere, that could be a potential area of where cancer has spread. So again, I'm not real familiar with how it works because I don't work with it. But I know that that's what it's used for, to highlight different areas of possible abnormalities.
Okay, Christy? Did
I
we do
don't
all
see
the
any other
questions?
questions.
All righty. Just want to recap for those of you who are left. If you miss a class, what you need to do is first email tgibbs@delamed.org. Let me know that you missed a class and what class it was that you missed, either by the topic or by the week. Then you go watch the video. When you're done, email me and say, Mr. Gibbs, I watched the video, and I will ask you a couple of questions about the content that you've watched and whatnot, just to make sure that you know you're more up to date on things. And that's the process there. Rebecca, thank you very much for joining us. Great presentation. And Christy, what do we have up next week?
Let me 1 second. We have psychiatry next week.
All right. Very good.
That'll be fun.
That one area that your discipline of scanning probably won't diagnose effectively, not on its own.
Correct. And you could probably ask them if they know of any imaging testing that could help with that.
Yeah, you already read my mind. Okay, thank
Yep.
you very much. Have a great evening, everybody. Bye-bye.
Thank you.